So
Please come.
are you excited for the interview?
Oh yeah.
So I would like to ask, what is your specialty?
I'm a neurologist.
And how many years have you been practicing?
Well, 7 years as a neurologist.
Long time. And where did you do your undergrad and postgrad?
All here in CMC. My MBBS and MD medicine, and then I did my DM neurology also here.
And what was your favorite part of med school?
Oh, my internship definitely.
You have some good memories from internship?
Definitely. Please come. Please come.
So what was your favorite part about internship?
Well, the best part was you got to so many different departments, and more than anything else, you had passed your final year MBBS. So no more books, just work, and I enjoyed working.
That's great. And what specialty did you think you will go to?
I was interested in many things. I loved psychology, I loved psychiatry. I thought I'd do pediatrics, but I ended up doing medicine instead.
What changed?
Well, my time in my bond was very special to me, and I did a lot of work in pediatrics during that time. So that's where I generated my interest in pediatrics. But when I gave my entrance exam, I lost it by one seat, so I had to do medicine.
And what made you love your specialty?
Well, medicine here at CMC was very unique. We had rotation in specialities like neurology, cardiology. That was a fantastic experience, and I think that was very, very, very important for me.
And what is the most unique part of your specialty?
Well, neurology is a fascinating field. I think I have access to psychiatry. Like I told you, that was something I wanted to do. I am looking after children with my Duchenne's muscular dystrophy, the work that we are doing. Also, we have a lot of technology that we use on people, and also the access to understanding people because of neuroscience and the biology of it. So it's brilliant.
So why should someone choose this specialty?
Well, for all the reasons I mentioned, if somebody is interested in a bit of technology, wants to do some procedures, wants to have in-depth understanding of human behavior, I think this is the best field to be in today.
And why should someone not choose this specialty?
Well, the training is hard. It is not something that is easy or comes intuitively. There is a rigorous process to get to where we are today. But I think it's your interest and it'll take you there.
And what are some of the stereotypes that are there in this specialty?
Yeah, they talk about neurologists as people who make diagnosis but don't do anything. That's the usual stereotype. Yeah.
Are they true?
Well, obviously not. If it was true, I wouldn't be doing this. It's a very challenging field in the sense that, like cancer was at one point, or HIV was, there was no treatment, and today neurodegenerative disorders like, Alzheimer's or ALS are diseases that are difficult to treat. So yes, we make diagnoses, very difficult diagnoses, which are difficult for people who are trained in regular medicine or other fields to make. And that's where you come in, and your skills as a clinicians are really tuned to make diagnosis. But in neurology as such, I forgot the question. Can you just tell me again? What is the question?
Are the stereotypes of this specialty true?
Yeah, sorry. So the stereotypes are not true, obviously. There is a lot of treatment that we give to patients who are with Parkinson's disease or say stroke. It's a phenomenal breakthroughs that have happened in epilepsy. And there are fields, of course, like aging, which is a very important part of neurology, where we don't have treatments or cures as such, but there's a lot of work that is happening, and it's the place to be if you want to make a difference and make a change.
And how many patients do you see on an average day?
So we are very lucky here in CMC that we don't do OPDs every day. We balance it out with our electrophysiological work and the lab work that we do. So on my average OPD day, I would see around 15 to 20 in my private OPDs. In a general OPD, we would see around 50 to 60 patients.
Okay. And what is the toughest part of the job?
Well, the toughest part, I guess, is the working up of cases is extensive. So we need to spend a lot of time seeing our patients. Over time, you develop skills where you're able to make impressions and diagnosis quickly in the OPD. But yes, it's a very meticulous and detailed workup of cases, so that takes time.
And what would you say is the most rewarding part of the job?
It is a very challenging field, and I love challenges. And there's a lot of scope for us to do new things that other people are not thinking of even. So the advances that we have and the labs and facilities that we have here in CMC are not available in most institutions. So it's a privilege to be working in this department as such.
And are there any times that you've doubted yourself?
Every day. I don't think that's part of life, doubting yourself, finding yourself uncomfortable. You're in the unknown, so you're trying to make out of chaos, trying to bring order. So that's a part of everyday life, so you're comfortable with it.
And what is your favorite thing to do when you're not working?
There's so many things I like to do. I love to play the guitar, I love to listen to music, I love to travel, meet new people.
Sounds fun. If you could change one thing about the medical field, what would it be?
Exposure. I think medical students today need to have exposure to what medical school actually is or what doctors do. And it is an absolutely amazing field to be in today. And they need to develop a range of skills, not just reading a book, but like what you're doing, recording a video. This is not required for your training at all. But this is a range and a skill you're developing: IT, coding, finance, business. All of these things are very important while you're training. So exposure.
Exposure. And would you do neurology again?
Oh, 100 times. Yes.
And what would you say to the aspiring neurologist?
Well, I would say work hard, which I'm sure they would do. And like I said to the medical students also, develop range. Don't be limited by the stereotypes in neurology. Work across fields, collaborate, make new friends, reach out to people. Don't remain where you are. So that's what I would say.
Those were your 21 questions. Thank you for this interview.
Thank you.